This is The Future of Everything. I'm Russ Altman, and I'm happy to present another emergency episode under the COVID-19 pandemic with Dr. Seema Yasmin. Dr. Yasmin is a professor of medicine at Stanford University with a specialty in disease outbreaks, epidemics, and pandemics. She has a really unique perspective because she has training as both a journalist and as a physician. So thank you so much for being with us today, Seema. I really appreciate it. Things are crazy, I know. Before we jump in, we have a little bit of time. Can you tell us, how did you come to this unusual combination of skills and interests in both journalism as well as medicine?
So I trained initially as a hospital doctor in the UK, became frustrated with the way that we were just patching up patients and not really dealing with the root causes of their disease. So a mentor said to me, "Oh, you're interested in determinants of health and public health." So that's what spurred me to come to the US in 2011 and to train as a public health physician. I served as an officer in the Epidemic Intelligence Service at the Centers for Disease Control and Prevention. And as an EIS officer, I was being sent all the time to investigate different disease outbreaks, to figure out what was spreading, how it was spreading, and how I could try and stop the contagion to keep people safe. And what I noticed during nearly every single outbreak that I was investigating was that disease was not spreading in isolation. Disease was spreading in tandem with pseudoscience and myths and rumors and all kinds of health hoaxes. And so eventually I thought, this is really strange that I have this particular narrow focus on the infectious part, the infectious disease part, but not on the infectious nature of the misinformation and the disinformation that's spreading. And the two are very much interconnected because the misinformation and, the falsehoods can fuel the spread of a disease. And oftentimes, because we know that no disease is equal access, and there's a very big health disparities, especially in the US, that people who are most vulnerable to the disease in the first place are also often most vulnerable to the spread of misinformation and disinformation. So I thought, if I'm going to be a really effective public health leader, I need to train in information. I need to train in storytelling. I need to become a journalist. So I went to journalism school and then landed a job as a newspaper reporter. I started that job just as Ebola arrived in the US from West Africa. So I went from investigating epidemics and being in the hot zone to still being in the hot zone.
To investigating epidemics.
Right, but covering them as a journalist, and still with that public health mission in mind and understanding that journalism is very much part of the public health ecosystem. I want people to acknowledge that more and more, and that journalists are frontline workers too. We send journalists into dangerous places, whether it's conflict or disease, to get us the information we all need to stay safe.
So that's great. And that sets up our discussion really beautifully. So I guess I can just jump in. And what do you make of this COVID-19? So as somebody who's looked at Ebola, I know you've looked at HIV, other pandemics, is this kind of exactly how you would have unfortunately expected it to go? Or has there been surprises along the way, even based on all of your experience previously?
There have been surprises. So on the one hand, to me, this was a predictable event. And in fact, when this was unfolding early on, Russ, my friends were like, "Oh, this is that thing that you're always telling us we should be ready for, right? You must be so prepared." And I was like, I am prepared, but this is still surreal. So on the one hand, yes, we think of these events as being imminent. We're always thinking about crossover events, the next infection that's going to spread from animals to humans. What I didn't predict was how bad the response would be in the US. Mm-hmm. And I say that as somebody who worked at the CDC, who knows that agency's strengths, weaknesses, limitations, but there's something very disturbing happening here in terms of the mistakes we've seen happen at the CDC and the way that we are seeing this agency being sidelined right at the time when we need its expertise. So I'll give you one example.
Yeah.
Early on in the pandemic, as cases started to increase in the US, we knew there'd been issues with testing, and we can talk about that. But the CDC was aggregating data on how many Americans had been tested, how many were infected. And this is exactly the kind of work that the CDC is primed to do. It does excellent surveillance work. It's how we know at any given time how many Americans have flu, how many have measles, how many have died, what ages were those people, were they babies, were they older people? And yet the CDC—
They're a very credible and trusted federal agency on the pecking order of where the public puts their trust, at least up until up until now?
I would say so, and still, funding issues, and there have been issues historically too. But I can tell you that one thing the CDC knows how to do very well is aggregate that kind of data that gives us the snapshot of America's health. And what we saw happen here, Russ, was that data started disappearing from the CDC website. And so in order to get that accurate snapshot of what was happening with COVID-19 in America, you had to literally go to 50 different states' health department websites. And again, that's where journalism comes in as being part of the public health ecosystem, because we have fantastic journalists at places like The Atlantic collate that information for us and say, CDC isn't doing this. We called up the 50 states plus the territories to get this information. So just the amount of errors, the mistakes that have been happening in the US's response, those have been startling. In some ways, some of the disturbing things that we're seeing now, for example, a disproportionate number of COVID-19 deaths amongst Black people, amongst Latinx people, some of that, as alarming and as disturbing as it is, and we should be very upset by that, was unfortunately predictable given health disparities in the US, given how poor access to healthcare can be for Black people, for example. But just the scope of it, the scale of it, I guess, it's still alarming.
I'm struck by your story about the Atlantic reporter and the CDC, because you said earlier that, journalism and part of your decision to become a journalist is because it's part of the response. And I was thinking, would I ever know that the CDC had removed data from a site? And the answer is no, I don't go to it frequently enough. But who would know? A journalist who's trying to track on a daily basis these kinds of numbers. And so right there, you can see the beautiful dance, if you will, between the journalists and the government, where if everything's going well, they're keeping each other honest. And here's a case where the journalists obviously said, wait a minute, we call foul.
And we've seen that time and time again, Ross. We saw a fantastic LA Times report that came out yesterday. So I don't even know what day it is anymore.
So this would be something like April 9th, would be yesterday. Today is the 10th.
Thank you. Who knows what day it is anymore? We're just at home.
We try to make these evergreen, but with the way things are moving, I think we can timestamp our discussions.
Yeah, sure. And I think it's important to, because I want to acknowledge some really incredible reporting that came out of the LA Times that was showing us that states that are receiving personal protective equipment for healthcare workers, they're saying the PPE and the ventilators are disappearing, and that federal authorities are taking them, not telling them where they're going, and not being transparent. That's exactly the kind of journalism we need. And unfortunately, I'm making this point about how important journalism is during a public health crisis, at a time when newsrooms are laying off journalists and giving 30% pay cuts to those that they are able to retain. So as much as we are worried about public health being in crisis, we need to worry about the state of journalism too.
This is The Future of Everything. I'm Russ Altman. I'm speaking with Dr. Seema Yasmin about pandemics, epidemics, and the current responses. And I do want to talk about this issue with journalism and journalists really on the front lines, and they really are quite remarkable. And somebody who doesn't think about this might say, well, but we now have Twitter and we have social media. I have many ways to get information other than from a mass media.
Many ways to get misinformation too.
So tell me about that, because I know you've studied this.
So this is what I do. I'm director of the Stanford Health Communication Initiative, and we're studying and tracking the concurrent spread of disease, but also misinformation and disinformation about disease. And one of the things that we do is actually engage scientists and healthcare workers to make sure that they can really accurately and in a compelling way communicate the accurate information with audiences, so that it's not just the misinformation that's reaching people. We have so many studies that show that when it comes to information, the stuff that's not accurate often spreads farther, wider, and faster than the accurate information. And
so let me ask you about that, because I know I was actually, you and I discussed this before we started our conversation. I was just on a TV network being interviewed, and of course, everything I say, I'm trying to be careful. So I'm decorating it with maybes and ifs and if things work out. And that is, I feel good about that because it's accurate, but I can tell that it would be much easier to say things that were absolute and, clear as a bell, but perhaps wrong.
And there are people who are doing that, Russ, who are much more appealing often to journalists.
Exactly, they're more appealing than me.
They're speaking in certainties, when actually we have a lot of uncertainty. So I've been doing a lot of trainings, webinar trainings for journalists at the moment. And one of the things I say to people is it's okay that there's uncertainty. I mean, it's not great, but
Right.
uncertainty is part of the story. So you have to stick with that instead of trying to wrap things up with a nice bow and present it as a complete story when this is a very evolving situation. Unfortunately, what happens during these situations, during public health crises, we've seen this over and over with Ebola and Zika and so many other instances, is there are people who have their own agendas. They want to
Yeah.
make money off this. In some cases, even right now, we're seeing people who are scientists but do not have expertise in this particular area, just want to make a name for themselves. And so they tweet hyperbole and they speak in, with a lot of certainty to news journalists. And actually, those people don't know what they're talking about. I'm quite alarmed about them because I see even my friends falling for them because those people appear legitimate.
So these are people with actual scientific credentials, but they're going outside of the scope of their expertise.
Right. And one thing that I say to my journalism students and the people I'm training now who work in journalism is you want to latch onto those sources who talk about the uncertainty, who when you try and get them to speak about the vaccine, they're like, oh no, I can't because my expertise is just in the viral, this bit of the virus.
Right.
Those are the sources that we like, not the ones who are like, yes, I can speak to everything and I'm an expert in all of these things. And unfortunately, fame is appealing to some people, and it's spreading a lot of fear and misinformation.
So I love the idea that you're training journalists to kind of pick up cues about when they're talking to somebody who's clueful and when they're not. Do you also talk to the scientists and the doctors about ways for them to do their messaging that is most useful for the public?
Yes, and it's very frustrating because I'm a journalist myself. So, recently I've been doing lots of very technical reporting, right? Trying to convey information about treatments, vaccines. And I often talk to scientists who are doing top level work, where I say at the top of their field. I'm so happy I landed an interview with them. And they cannot explain what they do in plain English. And so they lose people. And this is even with my coaching and I'm on deadline. They're not people I'm formally training, but I have them on the screen in front of me. And I'm like, so maybe just backtrack and explain that in a different way. And they can't do it. And the reason that is a problem is because if they're not getting the airtime, if they're not getting the platform, then the people who are not credible, they get it instead.
And this sounds like the kind of thing that would have to be done. This kind of training would have to be done when we're not in the middle of a pandemic. And I can tell you as a professor, yes, we teach. And so we try to hone our skills to some degree by teaching and explaining to students. But as you know very well, that's different from boiling something down for our mothers or our fathers or our grandmothers, uncles. And that's really what's involved when you're looking out to this. So what about, is there a way for you to train everybody in inoculating them? That's a loaded word these days. Against social media. And again, this is another thing that probably we should be training little children in school as they're growing up in this new world of mass media. Do you have best practices for regular people who are just trying to make sense of the internet in terms of getting to the truth and not being misled by these very, I'll use the word kind of attractive falsehoods?
Yes, there are some best practices, but before I get to that,
Yes.
you used the word inoculation. You said it was a loaded term, but actually there is a phenomenon called inoculation theory in social psychology, something that we're investigating at the Stanford Health Communication Initiative, which is this idea back from the 70s, I want to say. Inoculation theory is this idea that you can prime and protect people from false information in the same way that you give someone a flu shot and it has, a version of flu in there or some part of flu that's weakened and gives them an immune response so that when they're exposed, they're like, aha, I know what this is and I know how to fight it. You can do the same thing with misinformation and disinformation. You can say to people, for example, hey, there's this myth that's going to come along. It says A, B, and C, but actually it's wrong, and it's wrong because of, and what you need to know is X, Y, and Z.
And here are the motives of the people who are spreading this.
And so that's called pre-bunking as part of inoculation.
Pre-bunking.
So that does exist. It's fascinating. It's part of what I study and work on because we're up against it now during COVID-19, absolutely. But, the rates of measles and mumps and whooping cough have been going up because of these very well-focused, very sophisticated anti-science, anti-vaccine campaigns.
Yes. And they even organize. These are not single actors. They create organizations.
Oh my gosh, with names that sound really healthy and like they're just promoting nutritious food, actually,
Yes.
some of them. But even if you look at Minnesota, where, recently that state had its biggest measles outbreak in 30 years. And it
Mhm.
was very focused in the Somali American community. All these young Somali kids were getting measles because their community had very specifically been focused by these anti-science organizations. This is a problem we are up against all the time. Some of my best practices, including being a bit skeptical. And instead of sharing something immediately or believing something immediately, doing your due diligence. I know we're in a 24-hour news cycle, our timeline's updating regularly, but
Yes.
really taking a moment to step back, think about what source is this coming from? Who created this information and what could their agenda be? Trying to trace it back to some original source. Those are just some really basic, really easy things that you can do before you believe something, and certainly before you forward it.
That's really helpful, because I think we can all use that as a check as we process way more information than we've ever been asked to process on a day-to-day basis, with direct implications for our own personal health. Let me ask you about you've been around the world in many senses. Let me ask, are there cultural differences in these phenomenon, for instance, in Europe versus the United States, that you've observed, or other places in the world?
Yes, and we have to have localized responses in regards to that too. In some ways, many of the messages have a global effect. Anti-vaccine campaigns have been effective in Romania and in the US and in Brazil, right? So that's not necessarily unique. But like I said, with the Somali American community and the way it was targeted, it was very specific. And so there are organizations that are sophisticated that will completely tie their anti-science messaging in to the specific cultural beliefs of some communities. So that's something I worry about. I also worry about the fact that there are communities that are more vulnerable to misinformation because they've had a long-standing history of misrepresentation in the mainstream media, or because they've had really terrible interactions with the medical establishment. You think about the legacy of Tuskegee in the US, where people who are Black, who were poor, who lived in rural America, were left to die with syphilis instead of being given a treatment. That wasn't that long ago. And we're seeing very direct public health
And it's
consequences.
very much on the minds, I know, of African
Totally.
Americans when they're asked to participate in medical research.
Absolutely.
And now when you present them with this pandemic, and we're doing, you say to them, we're doing these things to help you, it is very understandable why they would say, well, let me just wait a minute and think this through, because there's been other situations where you weren't really trying to help me.
Truly, yeah. So we see that, and we have to be very careful in addressing that context and that history. We can't have, I don't think, a one measure that just works for everybody. And that's why I've actually gotten frustrated with the World Health Organization in the past, as it's told us, oh, there's a really bad measles outbreak in Romania right now, but it's okay, we're handing out pamphlets. I'm like, you can't hand out a piece of paper with some bullet points on it when there are much more sophisticated bad actors going in there that are targeting information to the specific beliefs of those communities.
This is The Future of Everything. I'm Russ Altman. More with Dr. Seema Yasmin next on Sirius XM. Welcome back to The Future of Everything. I'm Russ Altman. I'm speaking with Dr. Seema Yasmin, and we were just talking about disinformation and pre-bunking. Great idea and new word for me. I think you had a couple of things you wanted to say about that.
Yeah, because you were asking about how we see localized misinformation and disinformation. And when I was reporting on Ebola in West Africa a few years ago, during that biggest Ebola epidemic in history, I saw firsthand how difficult it can be to spread accurate information in certain areas. So for example, early on in the Ebola epidemic in Liberia, there were people in the community who were saying this isn't a real disease. And the government was like, no, this is real. People are dying. Please take it seriously. But in the context of a country that's had civil war, it's had civil conflict where the government has not been trustworthy, the government's been awful, that has these very direct consequences on public health now. And we also saw tricky situations where the CDC went in, for example, into Liberia, Guinea, Sierra Leone, and was spreading accurate information, saying things, for example, like there's no treatment for Ebola because there wasn't at the time. The case fatality rate is this, there's no vaccine. And people would say, well, that sounds terrible, so I'm going to go to a traditional healer instead. And so then you're up against a situation where like, well, the spread of accurate information had a consequence that wasn't predicted, should have been, and had a fallout that was bad for public health because people going to traditional healers then sparked more clusters. So it's tricky. The communication aspect is challenging. And I wish that in science, we didn't talk about communication as an afterthought. I wish we incorporated it into epidemic investigation communications in the same way that we think about surveillance and we think about stopping the spread of disease.
So that makes me actually, I wasn't going to ask about this, but as you have seen in the US and in other places, sometimes the government recruits opinion leaders like Beyonce or a famous rock and roll country singer. What's your take on that? So part of me says, well, why would somebody with absolutely no medical expertise be useful? But now, as you were describing what was happening in these other situations, I'm wondering if these can be kind of an independent voice that might engender trust in some way that the authorities don't.
I think it can be really smart to leverage the cultural capital of people with these huge platforms. And it works, I think, when it's done in tandem, in collaboration with credible organizations. So Columbia University in New York did this quite well a couple of weeks ago, Russ. They recruited the actors from the movie Contagion, people like Kate Winslet
Yes.
and Matt Damon and Jude Law, to spread really accurate information and say, hey, you saw us doing this in the movie. This is real life. We need you to take this seriously. We need you to do physical distancing. I think it can work really well. We've also seen the aftermath of celebrities who spew misinformation. There are so many who are anti-vaxxers, and we've seen how harmful that can be. But the flip side, as you mentioned, is
Yes.
working with celebrities at times like this to say, help us get credible information out there.
There was a great public service announcement I saw on television where they got all of the actors who had played physicians on TV, Doogie Howser, the guys from Grey Anatomy, the people from Grey Anatomy, and they all said, we weren't doctors, but this is serious, and please. So it sounds like maybe this is not a crazy thing to be doing as part of an approach.
It's a challenging time, and I think we have to be innovative. What's troubling is when we are not innovating at a time of crisis. We just have to be careful that we're doing it in a way that gives accurate information to people who need it most.
So I wanted to get your take as a journalist and as a physician on the ways that different governments have been reporting information and kind of spinning the situation. And I it's kind of an open-ended question, but do you have impressions about, the big players have been China, the US, people have paid attention to Italy and Iran, and also all governments. What are you seeing from the top down, and is it responsible? Is it concerning? What's your general take?
It's such a mixed bag depending on which official you're looking at. So you can look at the United States, where the president has been spreading lots of misinformation from his podium, and we've seen the direct impacts of that. So recently there was a man who died in Arizona, and his wife ended up in the ICU, and she said to journalists that he died and she got seriously sick because they heard the US president say that chloroquine could treat COVID-19. And so they had taken the chloroquine they had in their house, which was formulated to be a fish tank cleaner, and he had died and she had wound up in the ICU. So we can see these very real-time effects of political communication. And then I think about also people like the Singaporean Prime Minister, who's done, I think, a good job of conveying information in a timely way, very frequently, and in a way where they're not sugarcoating the truth, but they're doing it in a way that's calm and still offering some hope to their citizens. So very varied around the world.
I was impressed with Singapore because they did what you might call very invasive, privacy invasive measures to control. But my understanding is that in that context, the government then tried to be very transparent about what it was doing and why. And I don't know the details, but it sounds like that they struck a balance that the population, for the most part, accepted, despite these somewhat invasive, we're tracking your cell phone so we know who you've been close to, which by the way, is something that might be coming to the US.
I mean, I do want us to be careful about making sweeping generalizations and handing out trophies and medals to different governments because we're still in the crisis, and we're going to need to do a lot of analysis after this and really learn from ethicists and sociologists and behavioral psychologists to really understand the impacts of some of these governmental measures.
You mentioned the president at his podium, and I was struck because at the same podium is this Dr. Anthony Fauci, who I'm sure you know is a director of one of the institutes at the NIH, and who has really become kind of a rock star hero. And it's my impression that operating under very difficult conditions, he's been a kind of a rock of reliable and frank information that has, I think, had my impression is a huge positive impact on the temperature of the country. I don't know if you share that assessment.
So I have been noticing that there are quite energized campaigns against him, trying to discredit him in
Really?
some right-wing media. And so, yes, he has this position on this platform. He's at the White House briefings, not all of them, many of them. You often see hashtag Where's Fauci trending on
Yes.
Twitter whenever he's absent,
Yes.
because people are looking to him as this beacon of truth. But there are actors out there who are trying to discredit him. So that's something we have to be mindful of too, is that even as scientists who have credibility and who have all this expertise, those same people are vulnerable to these campaigns by anti-science organizations and outlets.
You know, so as we finish up, I just wanted to, you said something that was very interesting, which is that, you know, we shouldn't give out any medals yet, and there's going to be a very serious re-examination of what has happened once things calm down. And I'm wondering, have you seen this happen in the context of Ebola, HIV, the other pandemics and epidemics that you were involved with? And do they lead to action and change or not?
They can do. And I think HIV is a movement where it changed the way that actually we practice medicine, the way that we advertise medicines to the public. And activism, HIV/AIDS activists completely revolutionized even the way the FDA approves drugs. So the HIV pandemic, why I wrote a book about it, in so many ways change the course of medicine. And I think there are many lessons to be learned about what not to do, how governments mess up, how communities end up stigmatized, and how we can totally bungle pandemic responses from looking at HIV/AIDS. And also a glimmer of hope there, where it was really community organizers, where it was really grassroots advocates and activists who did some of the best work during the HIV/AIDS pandemic, of course, with scientists as well.
Yeah, so I think that we should all expect that there will be a public support for preparation for the next pandemic, and it would be a terrible waste, it seems to me, not to mobilize that public interest and say, okay, let's do a ventilator census, let's get our masks, let's have...
I would caution against that though, because the way that we operate in public health, I would caution against your hope, I would say,
Yes.
because we operate in a panic neglect cycle where we completely lose it and panic during the crisis. And then afterwards, it's like nothing happened, which is how we have ended up now with a SARS vaccine that we could have had, but was shelved in a freezer in Texas, where it lost funding a few years after the epidemic of SARS, because people were like, oh, I'm not thinking about that anymore.
So despite my optimism, I take it very clearly that you're saying that we need to be much more deliberate, focused, and organized in the post-analysis of this response to make sure we don't have to learn these lessons again.
Absolutely.
Well, thank you very much. This is The Future of Everything. I'm Russ Altman. My guest has been Dr. Seema Yasmin. Thank you very much for listening, and listen anytime on the app for SiriusXM. Thank you very much.